does WHO have some analysis that detect the reasons why some countries, such as ours, North Macedonia, have so many deaths from COVID, while other countries have much lower death rates?
Yes, so we look at COVID-19 mortality quite closely, of course. And as you say, North Macedonia and other countries in the sub-region have quite high mortality rates compared to other countries. And we look at that in a broader context. And we need to take into account a lot of different things. And that includes the baseline vulnerabilities in the population. So what the population looks like in terms of the age pyramid, how many older people there are in the population, the presence of chronic diseases or non-communicable diseases, such as things like diabetes, which might be on the increase in North Macedonia, and that makes people much more vulnerable to COVID-19 or to the severe form of the disease. But we also need to take into account the health systems, the way that they're resourced, the clinical care, the quality of care that's given. And that really depends on several things as well. The pressure that's placed on the health workforce when the number of cases gets very high. And we've seen very significant waves of transmission in North Macedonia. So when there are many more cases presenting at hospitals, then the quality of care will decrease because the healthcare workers are placed under undue pressure. So we really need to think about the things that can drive mortality down, and there are several of those.
What does WHO, for example, recommend to North Macedonia maybe to lower these death rates? Is there something that we can do?
There are very many things, and some of these things are already happening now, such as the work that WHO is doing with our colleagues in North Macedonia to really improve the quality of care in intensive care units in hospitals, to make sure that the provision of oxygen is delivered at the right time, and that people who don't need to be placed on mechanical ventilation don't get placed on mechanical ventilation. But there's also other things, and we have a very powerful tool right now. And because most hospitalizations and deaths are among the people who are more vulnerable, i.e. those who are older or who have chronic diseases, we can drive mortality down by increasing the number of people who are vaccinated. People who are vaccinated will be protected against hospitalization in the most part and death. And that will have a very dramatic impact on the mortality in North Macedonia.
Here they say maybe North Macedonia should ask for help from WHO.
WHO works very closely with our colleagues in North Macedonia. We have a team there, a presence in the country at all times. And I'm based at the regional office, and we're always in contact with our country office colleagues, and we are able to provide any support requested by the Ministry of Health, whether that may be support in terms of bringing in very specific expertise, or bringing in additional supplies, or helping the Ministry of Health or other government authorities do reviews of how the pandemic has been managed. We already provide that type of support, and we're working closely. And of course, if there's additional support needed, we can provide that.
Lots of the countries now are giving a third dose of the anti-COVID vaccine. What is the opinion of WHO on the third dose of the anti-COVID vaccine? Is it too early maybe for a third dose, or is it more important for people who haven't got any shot to have their first shot?
You've hit the nail on the head, especially in countries like North Macedonia, where there's still a very significant proportion of the population, of the adult population, who have not had their first or their second dose of vaccine. That is the most important thing now. The second dose, the full vaccine series for the adult population, but in particular, the older age groups. Right now, with a very severe variant of the virus that's circulating, this Delta variant, which is causing this resurgence across Europe, it increases the risk of hospitalization. We're coming into the winter season. Cases are coming down in North Macedonia. That's great, but they're still high. And so people should not hesitate for getting their first and second doses. And then once there's a very good coverage and all of the vulnerable populations are protected, we'll see a dramatic change in the epidemic in North Macedonia, and then we can talk about a third dose.
Is it safe to mix the doses from different manufacturers of the vaccines in terms of the third dose of the vaccine?
I wouldn't want to generalize on that at all. We're continuing to learn about different vaccines and the different mixing of doses. We have put out some specific recommendations for certain vaccine products, but it's impossible to generalize. But I would recommend that people seek information on this on WHO's website or on the Ministry of Public Health's website.
What is the impact of the vaccination against COVID on the pandemics so far?
You just need to look at countries that have very high vaccine uptake in their older age groups. And there you will see a very dramatic change in the way the pandemic is affecting both the health of the population, but also the economies and the ways of life. In countries that have very high vaccine uptake, we see very few hospitalizations and deaths compared to the number of cases. Yes, transmission will still happen, but you won't end up as much in hospital and we won't have as many deaths. In addition, because of that, the restrictions placed on society, the restrictions to our daily business can start to be lifted. And so you enter into a different phase. We always need to stay vigilant. And to get to that level, there needs to be a very significant uptake. And North Macedonia is not there yet in terms of vaccination. There's still a long way to go, and there's still a very significant hurdle in front of all of us, which is the winter, and we can't predict what will happen there.